Gregor, what an incredible time it's been for you, a mad time over this past year, I imagine. But obviously now we have gone back into lockdown, and I was one of the ones who received a text the other day. I was previously shielding. Can you tell me a bit about shielding this time, and are we even calling it shielding it now?
I think that's a very good question to start with. Is it shielding or not? And a lot of people are uncomfortable with the term shielding. I know from speaking to people who've gone through that experience in the past, it's a really difficult experience, as you know, to be kind of shut away from people that you know, and just to the extent that people who were previously shielding did. It's a very difficult experience. We're very conscious of that, and I'm very conscious of the fact that some people are uncomfortable with the term. Nonetheless, there is a really important stage that we're at just now, because with the type of transmission rates that we're seeing across the country and the levels of infection, we've taken the very difficult decision this week to recommend that those who were formerly shielding, that they should take additional precautions again. And that goes to the extent of, at this stage of the pandemic, we're actually providing them with very strong advice to stop going to work and to work from home. And if they can't work from home, to speak to their employers about how they stop work. We've provided a letter which will go out to all those people this week, which will enable them to have those discussions with their employers, so that they will be recognised as people who need to take that additional level of precaution.
And when can we expect that letter? Will that be in the next few days? Because I think from everyone that I've spoken to, it's that kind of unknown period. You've had the text, but you're waiting to see confirmation as to what you've to do.
Yeah, I apologise. There is a little bit of lag time to make sure that the letter's properly prepared and then it's sent out to everybody. But yes, I expect that letter to start going out to everyone within the next day or so.
And if you were previously shielding and you don't receive a letter but feel you should be this time, what should you do?
Well, there's various things that people can do in those scenarios. There is a national helpline number that people perhaps have used in the past. I can give you that again. There's a national assistance helpline that people can phone for further information at 0800 111 4000, or they can speak to their GP if they feel that they have a requirement to shield, but they haven't ever been notified. And it's whether it's the GP or their hospital-based clinician, I think those discussions are really important, so that people are able to discuss what their personal risk might be. We've tried to move away from just the blanket advice that was provided to everyone in the first part of the pandemic. We recognise, as I say, the difficulties that this process causes for people, and actually the extreme burden that places upon them. And so what we've tried to do is we've tried to take a much more personalised approach to the way that we provide this advice. That means that people can assess both their own risk, but also if you like, their own tolerance of risk. It's not the general advice that we issued in that first part of the pandemic, where everyone was just advised to stay at home and to cut contact, because that's an incredibly difficult thing, both physically and for your mental health as well to do. But certainly at this moment in time with the pandemic, with these type of transmission rates that we're seeing across the country, we cannot escape the fact that there is an additional risk to people who are clinically extremely vulnerable. And the advice is to try as much as you can to stay away from other people, to limit your chance of coming into contact with coronavirus. We're not saying don't go to for the essential shops, don't. We're not saying don't go out for exercise. What we're asking people to do is to take extra caution as they do that. And where we know that there's additional risks that perhaps isn't justified, such as going to a normal workplace at this point in time of the pandemic, and they were advising people to work from home where that's possible.
Because I think that was the thing, that the last time it was very much like, you should only exercise in your garden, you shouldn't go to the supermarket. So when we get the letter out, that's not going to be there, kind of in black and white this time.
That's right. It's not going to be black and white. People, of course, may take their own decisions because of their own attitude towards risk, and they may decide that they want to just isolate themselves to that extent. However, at this moment in time, we're not advising that that's what they should do. We recognise that people still need to have some ability to be able to have the ability, whether it be for essential foodstuffs or whether it's just be the ability to be able to get out and take some exercise in a place which isn't the immediate confines of their own home. We all know the value of physical activity, and both for your physical and your mental health at this point in time, I think it's really important that people are still able to take that. And we know that the transmission risk, even for those who are clinically extremely vulnerable, is much less in that outdoors environment than in any indoors environment.
And for people who maybe then decide themselves that they don't want to go to the supermarket for that fear, last time obviously there was kind of food packages available and things. Is that going to be available this time?
Well, what we've, I guess the supply chains and the way that we've worked with the supermarkets is much more sophisticated than it was in that early part of the pandemic, and the delivery options are much more readily available from many of these supermarkets. And again, what we've organised is for people who are on the clinically extremely vulnerable list is to make sure that they get priority access to those delivery slots from supermarkets and are able to obtain supplies in that way. We've also made sure that I'm provided advice that, again, if supermarkets are able to signal when they are perhaps quieter, and for people who are clinically extremely vulnerable to maybe attend at that time. A great way of doing that is just looking at the opening times online for various supermarkets, and you very often see alongside that is times when these supermarkets are quieter during that period as well. Certainly my advice would be is, don't go at peak time. Make sure that you are just limiting the opportunities to have contact with people who may, unknown to them, be out and carrying coronavirus.
And you mentioned there that that's obviously the advice at the moment. We don't have a crystal ball. Is there still a chance that further advice could be brought in and we will be told that no, we have to stay in? Is there still that possibility?
It's a situation that we constantly have to monitor, Laura. I mean, we're balancing a series of risks constantly in relation to this. As I've said on a couple of occasions, it's an incredibly onerous thing to ask anyone to shield, and it's something which we do after only very, very careful thought. However, depending on how the next phase of the pandemic plays out for us, it's something that we should continually keep under review. At this moment in time, I'm very fortunate to say that we're not advising a return to that full shielding. I think that would be a very heavy burden to place upon people again. But we obviously continue to monitor that situation. And if there's any change at all, we would, of course, update people in the usual way, both through the text messaging service that people can register for, through the news announcements that we make. And of course, I would continue the right to people as well, just to update them.
And like everyone, the hope for the vaccine is the biggest thing. And obviously, if you are vulnerable, I know in my situation, that is something that we are very keen to get. So still this, kind of looking ahead and hopeful that people in my situation will get that sooner rather than later.
That's right. I mean, those who are extremely vulnerable, who because of the clinical conditions that they carry with them, those people will be at the forefront of the vaccination programme. And when the JCVI, that's the Joint Committee for Vaccines and Immunisation, assessed the prioritisation, that was one of the factors that they took into account. And people who are clinically extremely vulnerable, those who have been shielding in the past, are alongside those in the older age brackets in terms of the risk, and will be, as I say, in the early part of the vaccination programme that I would expect probably would start for them at some point in February.